Now the next topic we have called Healthy Mouth, Healthy Body. Now how many of you remember that old song, and I'm going to mess it up a little bit, I'm not going to sing it, but you know, the toe bone's connected to the shin bone, thigh bone to hip bone. And what was the message there? And one of the messages was that your body is one. And anything that happens in one part of your body happens to another part of your body. You know, anybody that's hurt a foot and then had to walk funny ends up their hip is out because they've been walking differently. So, or his shoulder goes wrong. Baseball pitcher hurts his leg, he can't lift his leg up, all of a sudden he has shoulder pain. Our body is one. Well, what we have found, and more in the literature, is that diseases of the oral cavity in the mouth will affect your entire body. And when you think about it, you go, well, why did we ever think that the mouth was a separate little island, a separate entity, and things could go on in there that wouldn't affect any other part of your body? It absolutely does. It absolutely does. And sometimes people start to realize that when maybe they're going to get a joint replacement. And the orthopedist says, now before you get any dental work, I want you to take this antibiotic before your visit. You go, why is that? Because germs in your mouth can get into your bloodstream and affect this joint replacement we're going to give you. Somebody has cancer has to undergo radiation or chemotherapy. And before they start, they say, I want you to see your dentist, and I want them to write a letter that says you have no oral infections in your mouth. Because if we did chemotherapy and we knocked out your immune system, an oral infection could go wild and could kill you. So the health of your mouth affects the health of your entire body. I don't watch a lot of Oprah, but those that do, say there's a guy, Dr. Oz, is that right? You guys remember Dr. Oz?
He has his own show now.
He has his own show. Well, you know he's important. I think Dr. Phil's got his own show. And here's Dr. Oz right now. Let's welcome him. I'm going to mess up this quote unless my wife's going to help me. Come on, Lisa. What is Dr. Oz's quote? I know I can learn more about the health of a person by looking in their mouth than I can by looking at their cholesterol level. I can predict more about the future of a person's heart by looking in their mouth than I can looking at their cholesterol levels or blood pressure. Interesting. You want to comment on it?
That's correct.
All right. Well, what happens is there's tons of bacteria in your mouth. Okay. Now, the main oral disease we're talking about is gum disease. Gum disease, very prevalent, very prevalent. And in its introductory early levels, we call it gingivitis. As it gets more advanced, it's called periodontitis. And there's a tremendous amount of people that have gum disease in some extent, especially after the age of 35 or 40. Gingivitis leads to periodontitis, and it's a silent killer. You know, if I would just say to you, if I said, how is this man's blood pressure? I would look at you, sir, and say, you're trim, you look fit, probably your blood pressure is perfect. But it might not be. I hope it is, but it might not be. We'd have to measure, wouldn't we? Okay? I look at Gil Weidenfeld and said, how's his cholesterol? I said, look, he just looks like he came from the gym. It's like he lifted all these weights, he's in top shape. Probably his cholesterol's fine. Maybe it is, maybe not. You have to measure. Some people say, I wonder how my gums are. I don't have any pain, I don't have anything bothering me. Are my gums fine? Maybe, maybe not. You have to measure, you have to look, you have to measure pockets. You have to look at bone levels. There are things about gum health that you don't realize. And many times with gum disease, you don't realize you have it until it's advanced stages. Early and moderate gum disease, we're just not aware of. And gum disease is something, so we've got all this bacteria in our mouth, and then something happens where the seal is broken, and bacteria gets in the bloodstream, travels around, may lodge in the heart, may lodge on an artificial joint. If it lodges on an artificial heart valve, sometimes you lose your heart valve. Anyone who's had a prosthetic limb, knee, hip, ankle, can I see by a show of hands, anybody wants to admit having a little transplant or anything? You know, knee, ankle, sure, why not? These things work great. Cameraman's got one, they work great. Probably for the first year or two, when you went to your dental office, you were instructed to take an antibiotic before your teeth were cleaned. That's because whenever you have your teeth cleaned, you go to rinse, you see a little pink with ketchup in the basin, the blood can get out, germs can get in. The blood can get out into the basin, germs can get into the bloodstream, travel around and lodge anywhere. And the main problem it causes is inflammation. Jay, you want to talk about inflammation?
That's right. Inflammation, as you know, affects many, many things. You think of it a lot in terms of arthritis and joints, but it also affects our gums, our jaws. It affects our brain. There's a lot of research now with keeping healthy brains and mental exercises, just trying to keep the inflammation out of our brain and keeping good blood circulation. And there's research that shows that advanced gum disease hurts our brains as well. It hurts our mental capacities. So it's just one more piece of the puzzle. Oh, great. Great. There you go. Here's the list.
Drum roll, please. Things you don't want.
Other things that it affects are heart disease, clogged arteries, strokes, diabetes, dementia, rheumatoid arthritis, and premature birth, which I'm hoping is not going to affect anyone in this room. Although, if it does, you will be on Oprah, and that's a fact.
That's right. Inflammation is the bad guy right now. How many people remember for years and years and years, people say, oh, for your heart, take an aspirin a day, right? Probably a lot of people take an aspirin a day. And they say, oh, for your aspirin, take an aspirin. And they say, the studies show that the aspirin is great. It lowers the probability of heart attack and stroke. Aspirin is great. And it must be because it thins the blood. The aspirin thins the blood. Well, now, 30 years later, we look at studies, we say, hey, you know, that aspirin really does work. But it's not really because it thins the blood. Aspirin is more than a blood thinner and a pain reliever. It's also anti-inflammatory. And it's the anti-inflammation activity of the aspirin that we believe, and medicine believes, causes most of these benefits. Especially in the heart, you've got these nice little vessels in the heart, and when they become inflamed, the lining kind of cracks, it frays, and it has little barbs. And as the cholesterol goes by, it gets caught on a little fish hook and lodges. So the inner lining of the vessels start to fray and break from inflammation, catches the cholesterol, and the plaques start building up. It's really not the blood thinning, it's the inflammation. Many of you may, inflammation is so important that there's a test now called C-reactive protein. They come in and they take a blood test to see how prone you are to inflammation.
Very good.
Q&A.